Hello guys, good day po. My name is Jericho Edward Arceo. Last year po ako ay nag-part 1 ng non-surgical sa chin and jaw. Ngayon po part 2. Tutuloy lang po, no? Feeling ko po natunaw na. So itutuloy po ulit. And ayun, 12 years ago, nung iba pa po yung pwesto ni Doc Contessa, pinagawa ko na po yung cauterize, yung warts ko sa kamay. And then, paano ko nakilala? Through ano po, family friends. And matunog na po si Doc So, ayun. So, if you're watching this, please do not forget to click like, subscribe, and hit the notification bell for more updates.
Good day, everyone. Welcome to the CSA Medical Aesthetics. I'm Dr. Contessa, your certified aesthetic physician. In today's episode, it's a part 2 of the chin and jawline enhancement for our returning guest, Mr. Jericho Arceo. Welcome back.
Doc.
Yan. So we did a procedure like about more than a year ago for the enhancement on the chin, the enhancement on the jawline area. But we've also had some other treatments, like our Hollywood laser procedure, our spectral laser. We wanted to improve the skin quality, also target acne marks, acne blemishes, acne scars. How was it, Jericho?
It's so Hollywood, Doc.
It's so Hollywood. I can see the skin, so Hollywood right now. Yeah, there's a big improvement in the skin texture, in the skin quality. There's a reduction in your acne lesions, even the acne marks here on the jawline area, upper neck area. But of course, when you have this acne problem, it's a continuous problem, right?
Yes, Doc. Yes.
So we need a maintenance treatment for that one because we're still like doing some like you're doing oral treatment in the form of like a vitamin A capsule, which is actually our, drug of choice for certain kinds of acne vulgaris. We give it for those cystic acne lesions or stubborn acne.
Stubborn.
Acne resistant to topical treatment. So we prescribe the so-called isotretinoin. You have taken that, right?
Yes, Doc.
And you're still maintaining with isotretinoin.
And I have it now.
And he has it now. Okay. So it's something that's gonna also control acne lesions, particularly those cystic acne problems. That's why I'm seeing your skin, closed pores. Yan, blemish-free. Yan, it's a lot improved. But of course, you also have to still do your proper skincare, your cleanser, toner, morning cream, night cream, something to also hydrate the skin, maintain that normal cellular hydration. Yun. And plus, of course, some laser treatment to still target blemishes. Today, it's a part 2 of what we've done more than a year ago to improve the chin length, the chin projection, as well as also the jawline area, make it well defined. We did it so-called chiseled, chiseled or snatched jawline, okay? So it has been more than a year ago. What's happening with the hyaluronic substance is that over time it gets degraded, or we have some enzymes inside our tissues that will target these molecules and break them down, and it will be absorbed over time. Because you asked me a while ago, like, oh doc, is it gone? Well, some of it are already gone, but there are some remnants. Some of the hyaluronic molecules may still be there, okay? Especially the ones we inject on a deeper plane, so they kind of stay longer. Because when we're checking on some hyaluronic substance, when we do ultrasound of the face, we still see some remnants of these hyaluronic substances. Inside, for example, above the bone, we still see them. Okay, so it's been more than a year, but you still have some. Now, I was assessing Jericho a while ago doing the so-called rickets line. And when you do rickets line, we check on the tip of the nose, lower lip, and the gap on that chin and this line here. So I already noticed there's this big gap already, Jericho. There's a big gap. Yan, no? Ricketts line. Tip of nose, lower lip, and this chin. So that chin part should reach also that Ricketts E line or Ricketts aesthetic line. However, nagkulang si chin.
Dancing chin.
Dancing chin, or they're saying dancing chin. So we have to improve the chin projection. And another one that we check also is the length. So when we do the vertical dimension, the ratio should be 1:2. I did the measurement a while ago. There's a deficiency of 0.2 ng length.
Lang daw.
Yun, 0.2 lang.
Apuyat po ako.
Yan. So, with the anterior, the chin projection, and the vertical dimension, so we still have to improve that. Okay. And another one, looking at the jawline, I can still appreciate this part, the angle. Yan.
Thank you.
Because we want the angle for men wider. It's the bigonal width. We want the shape square. So for men, dominance of the lower third. Sa girls, we want our cheek projection, but we want narrower here on the lower third. For men, square, dominance ng lower third. That's why you have to bring out this angle of the mandible. Angled.
Grabe conception.
I can still see that good bigonal width. What we want to improve will be the mandibular line here. So we'll be working on the anterior mandibular line as well as the posterior mandibular line. So excited with the procedure, Jericho?
Yes po.
Yeah. And I want to add, I'm looking at you, the upper third, you're developing dynamic wrinkles. How young are you, Jericho? How young?
28 po.
20, late 20s. Well, aging, they're saying aging starts 25. So in a year, you're starting to deplete collagen 1%. So like late 30s, 20% na yung nadideplete. When we reach like past 50s, 50% na yung nadideplete. Okay. So we'll also do anti-dynamic wrinkle, jawline chin enhancement. We'll show you when we return. And we're back. So we're doing these markings for the chin area. So ideally for men, when we're working with the width of the chin, it should be following these corners of the mouth, okay? But for women, we follow the corners of the ala, okay? That's for women. So for men, we want the chin to be squarish, okay? Square-shaped chin. So a while ago, we had the measurement of the so-called Ricketts line, so we noticed that deficiency in the projection of the chin, so anterior projection. So this is the midline here. So we have two lateral lines here. So we'll be working on each side. We need to fill in this part to improve that anterior projection. And take note, for men, we wanted a squarish chin. So we'll be also using hyaluronic substance to fill in the inferior border of the mandible here. So these circles here will be the ones that I will be filling in. So we'll be improving the anterior projection and also the so-called vertical dimension. Now for my jawline area, I've mentioned a while ago, we still have this good angle of the mandible, so we're not working on this one right now. Our goal is to improve the mandibular line here. So this is for this part, the body of the mandible, then the ramus of the mandible here. Although I noticed some asymmetry, so the right side is kind of deficient, I might add a little bit here to balance with the left side. So now I want to improve this mandibular lines here. I'll be doing a so-called cannula technique, having an entry point here and deliver products just at the inferior border. Okay? This is to also kind of improve the proportions of the face, the upper third, the middle third, and the lower third. So we want the balance like a 1-1-1 ratios. Okay, Jericho? So I'll be working first on the chin area. Okay? Now I will use again hyaluronic substances. For chin and mandible region, we need Hygi Prime product with high viscosity, with cohesivity, elasticity, good projection, as well as volume correction. So all those rheological properties are needed there to achieve the optimal outcome. Okay, so I'll start working on the anterior chin projection. I'll be giving, I'll start here, you can start 0.3 to 0.5 ml per side. So I'll be working on the anterior projection, so onto the bone. Okay, so a while ago we already applied numbing cream for Jericho, so it's just gonna be tolerable for him. And the filler has a lidocaine with it, so he'll be having that further numbing once the filler is inside. So I'll be starting with my 0.3 here, and then after that I'll be working on the inferior borders. So I'll start with the center here. I'll be giving a 0.2 for every circle. So it's good to have this plan, this kind of markings for you to follow. Easier for you to work on the areas, the anatomical region you want to improve. Okay, and again here, inferior border onto the bone. So it's just a needle technique. So just the anatomical concerns here, what we're avoiding is mentalis foramen plus the branch of your facial artery. So as injectors, we are familiar with our anatomy. Okay, so this part here, 0.2 again. Then after this, I'll proceed with the cannula method to improve the jawline area. So we're proceeding on the jawline area here. So I'll start with this entry point. I'll be doing the so-called cannula method. I'll make a tiny prick with my introducer needle. This is a gauge 19, okay? And I have my hyaluronic substance again. Take note that your product should be a thick filler on areas like this. Our hyaluronic substance, they have different rheological properties, so it's important that physicians, injectors, practitioners understand the properties of this product. Okay, so I'm just gonna be gliding it. So take note, there's a so-called kind of adhesions or some fibrosis in the area because of acne scarring in the past. So we're just gliding it and doing a semi-subcision technique. So I want to reach this area here also. So just glide it, subcutaneous layer. Don't go at the periosteal layer. Supraperiosteal layer is not the layer for this one. So this is sub-Q layer only. So I have to do a so-called subcision. So it's normal to have some resistance. So do your kind of screwing or rotational method for your cannula there. So because of some resistance there, it's normal. So I'm just gonna do a so-called linear technique here. There you go. And I'm gonna go back again. You can go inferior to that, to the line, to lengthen also our mandible here. So I can give as much as 0.3 to 0.5 in this area depending on the need. Okay, I'm just gonna subsize again and deliver the product. Then after doing your filler, you can do your molding massage to smoothen out, make it even on the surface. Okay, so I can go at the posterior part using the same entry point. So just perpendicularly direct your cannula to this subcutaneous layer of your skin tissue area here. So our skin has 3 layers: epidermis, the dermis, and the subdermis or subcutaneous layer. Okay, so we want it in the sub-Q layer. So take note of the facial artery in the area, avoid that. So I'm just gonna glide it in here. So all the way to the angle of the mandible. There you go. So we want to reach the end point here, this part here, and you can just deliver your product in a linear technique. Linear retrograde technique. And I can go back again, reach this posterior here, and deliver one line again. And then go back a little bit and just deliver more. So I said I will be doing a small injection, a bolus injection, or so-called gunshot technique at the angle of the mandible. Direct it onto the bone. There you go, it's already the bone. And just add a 0.3 here. Okay, just onto the bone. And that's it. So we've done the right side. Let's proceed to the left area. Done chin enhancement, jawline enhancement. Let's also work on the upper third by injecting the wrinkles. Okay, Jericho, wrinkles naman. Okay, you're 28. Sige. Actually, Jericho, I have patients 18 years old, 19 years old, having dynamic wrinkle already. I'm just spraying a so-called pain freezer here to numb the skin. So if you don't have the EMLA or numbing cream, you can also spray with this pain freeze. Okay, so just wait for some frosting there. Yeah, it's cold. That's why they call it pain freeze, pain ease. Okay, something cold there. Yeah.
Pag mainit ulo, madok ka
Yes.
din.
Yeah, we can spray that. So I'm using botulinum toxin. I'll start with the crow's feet area here. There you go. Just tiny injection here. Just make a bleb to get rid of the lines there. And then we'll also do the other side here. The right crow's feet injection is just tiny blebs here. And then we'll go with the procerus muscle. So this is the one that creates your frown line, tiger line, lion line. Okay. Others have the so-called bunny lines here on the nose. Then let's do the forehead wrinkles, horizontal wrinkles here. So just make a blend there. Sorry for the multiple injections. You can do it. These are just tiny needles. So we have done chin and jawline enhancement as well as the upper third Botox. We'll show the result when we return. And we're back. Let's show the result to Jericho. Jericho, look at that. So here's your mirror. Yeah. So there was an instant result. So I can already see like a good projection of the chin and that better vertical dimension, plus the angle of the mandible and also the mandibular line were improved. And with the Botox upper third, we still wait for 2 weeks before we see the full effect of our botulinum toxin. So how was it, Jericho?
Doc, I feel like a new man. With a new chin.
Yeah. So we did the combination techniques, like we had a needle, more of a needle method on this chin area. And then the jawline, we use cannula technique with our hyaluronic substance. So with this kind of treatment, you see an instant result. And as to how long do they last? Well, in our textbook, it tells us that these kinds of products, they can last 24 months. But recent reports were saying that even up to 5 years, we can still see some of the hyaluronic substances. So Jericho, yan. How was the procedure? Like, because others are worried about pain, discomfort. So how was it?
Ito pong second part, Doc, I think
Yes.
mas less yung pain as compared to the first.
one. Yeah.
Nung nafe-feel ko po, siguro po, konting pain dun sa bone part.
Bone, yeah.
Pero yung mga may foundation na, wala masyado po.
Right, because this is already the second treatment. So during the first time, we did the combination cannula and the needle technique on the chin area. I was doing a lot of subcisions there. So when we're doing subcision, it's quite uncomfortable with that one. But it's tolerable,
Yeah.
right? And worth it. Worth it yung procedure because you have this like proportioned face, balanced face, and contoured jawline. Yan. it's still you, Jericho. We didn't alter your look.
Yes po, still
I'm
me.
pretty sure they will recognize you at home.
Yeah. Oh, who's this?
Okay.
Alden.
There you go.
Ayun po, so if you guys are interested, please give it a try. Kung pain po inisip nyo, it's tolerable, especially ngayon pong second. I'm surprised na I thought I was gonna...
Yeah. You're already second time, so you already know what to expect, right?
Yeah.
Yeah. And plus, it's clinically safe, clinically proven
Yes.
safe. And all these materials, all these products that we're using are FDA approved, okay? So no worries about, like, some are thinking of dangers or some are thinking of bad complications. There you go. So we've been doing this for a very long period of time already. So it's also like an anti-aging treatment. What we're doing is prophylaxis, preventing the aging of the face, because over time, everything will sag down or descend. The soft tissues will also kind of like droop down. So it's also a treatment as a prevention for the aging aspect and enhancement, and also like balancing the face. Okay, so if you have any questions, you may email us at csaskinclinic@yahoo.com, our FB page CSA Medical Aesthetics, Instagram CSA Medical Aesthetics. Our clinic is located here at the Infinity Shop, Pulong Maragul, Angeles City. Contact number 0933-860-9193 or 0917-504-4268. And please do watch the previous episodes of Jericho. So it was not only one, okay? So like, look at our channel, Contessa Salvador, and please do subscribe. Okay, like and subscribe and share. Can they follow you too?
Yes, please follow me, Jericho Arceo, TikTok, Facebook, YouTube, and don't forget to ring the notification bell.
Thank you so much. God bless you all. When it comes to natural beauty, you can trust the CSA Medical Aesthetics.